I call my insurance. They say, well, you're approved till the end of the year. Okay, well, this company's telling me they're not covering it anymore. Oh, well, we don't deal with them. What? Huh?
You're listening to Mastcast, an SM podcast where your hosts, Candice and Rachael, explore the complexities of living with a rare chronic disease through personal experience, patient guest stories, caregiver perspectives, insights from specialists, and updates from the research and advocacy communities, with the purpose of bringing knowledge, connection, and hope to those affected with mastocytosis and related conditions.
Hey, y'all. This is Candice.
Hi, this is Rachael.
And we're here for our second Hero Summit episode, so mini-sode, where we're going to talk about one of the aspirations in depth. So we're going to discuss, each episode will be on one of the aspirations that we had our panel discussions around, or our breakout sessions, rather. And if you hear a cat yelling in the background, my sincere apologies. And this
She just has a lot of opinions about mastocytosis, okay?
He's just so desperate for my constant, unyielding attention that if I close a door, he has a meltdown. Anyway, so we're going to discuss the aspiration that is patients have the knowledge, empowerment, and skills to confidently live with SM. I personally, Rachael, I don't know about you, but I felt like this was one of those where I felt we could really sink our teeth into it and find it didn't feel out of reach or impossible to achieve.
I felt like I had a lot of opinions on this one because, like, obviously it speaks to specifically to our experiences, you know, and like what we feel like ourselves and people like us really need to navigate living with something like this.
Yeah. So we outlined the barriers, and I'm interested in it, especially from your perspective, given how long you've been diagnosed and how those barriers have changed, because I would argue you had nothing but barriers at the time of your diagnosis. And I would just like to kind of go through what I've laid out and what other, or, you know, what the poster laid out and what other things that come up in your mind and how that compares. But please continue.
Yeah, no. So I think that there were certain things that were in my favor when I was diagnosed, which I did the math recently, and I think it was like 17 years ago, which is like, I don't feel old enough for that, but here we are. Time is big to me. But I think that the things that went, like, that I know that weren't barriers was that I found a dermatologist who recognized my cutaneous mastocytosis nearly instantly. It was the second one I'd went to. So the first one was a couple years earlier, so there was a delay in diagnosis. But once I found like the right doctor, it was more efficient because of that. But outside of that, getting other, like, once I had a diagnosis, getting the information I needed, getting the right doctors I needed, like there were some resources. At the time, the Mast Disease Society went by the Mastocytosis Society. Obviously, they've expanded, but they were the best resource out there. And I think they're still really high on the list, extremely high. And I think that there are still barriers that exist, but that they have changed and shifted over time. I think there was like a lot of misinformation when I was diagnosed. And then things got like, but then the more people that have received diagnoses, which I think has improved. I've heard that the diagnosis time, I think when we talked to Dr. Abbas, he was talking about how the diagnosis time has improved a little bit.
5 years, I think.
It was, I remember
average.
Hearing someone tell me it was 19 when I got diagnosed 17 years ago in 2009. So
wild.
That's a vast improvement. And as there's more recognition and acknowledgement of mast cell diseases as a whole, mastocytosis obviously being a huge part of that, I think a lot of more misinformation has popped up in different ways than it was before. Before it was my doctor that had misinformation, and now I feel like it's my doctors still don't know enough. And
but they have access to more accurate.
They have access to more accurate stuff. There's more
readily available.
Yeah.
Well, so just to talk about the barriers as we laid them out before, and I think that those will be the same that you faced then, maybe at a lesser level. But some of the things that were discussed, and there were several groups that discussed these issues, but lack of accurate information, as you were just saying, like having too much misinformation out there. Lack of knowledge about available resources. So there are accurate resources available, but finding them is getting easier, I would argue. But even when I was diagnosed 3 years ago, the first thing that popped up was not TMS or some other reliable systemic mastocytosis resource. It was random, like NIH papers from 20 years ago that said you'd die in 5 years or something.
Love
Like,
that.
yeah, right. Another one was language barriers. And I don't mean as in different languages that we speak, but as in the language around systemic mastocytosis. So are we using the words, and are the words that we're using, do they mean what we think they mean?
Right.
Are we like having a conversation using language that has mutual understanding and definition? And I think that that's like we could talk a lot about that, I think.
I have some thoughts about that for sure.
Yeah. And I guess I mean, I didn't plan this out exactly. I just had our things, but I figured I could go through the list and then we can go kind of
That's what I
back
was
and
thinking.
discuss them. Okay.
Totally.
Yeah, so then other kind of in line with language barriers is communication styles and preferences. Not everybody receives information the same way. Not everybody shares information the same way. So there's a barrier there. I think especially, and I think this is true for any type of chronic disease, cancer, anything that's kind of serious and has like a lot of social and emotional weight behind it. When you're first given something like that, I don't think it's really I don't think anybody gives you the full time to diagnose even what you've just been told, and then you're just given a bunch of information, and then you're sent on your way, and it's like, "Wait, I didn't process any of that." I have yeah, anyway.
No, absolutely.
And then patients' ability to navigate complicated systems, I think, are a real barrier because that's gonna vary person to person on so many things, which we can get into. And then a physician's inability to guide patients. So if we're talking about fostering knowledgeable patients who are empowered and have skills to navigate the disease, and there's a systemic thing that has to happen here, right? And unfortunately for them, I guess, it falls to the practitioner to help us overcome those barriers. So which one of those kind of stands out the most to you?
They all, I mean, in different ways, they all stand out. I think it would be interesting to talk about the language barriers for a sec.
Mm-hmm.
And because I think that we pointed out during the meeting, we were some good conversation around that. Things like, and I have seen some shifts in language. So, for example, the word indolent doesn't actually, technically,
Yeah.
it means not harmful.
Yeah, yeah.
And I think
Slow growing, not harmful. Yeah.
right, so when doctors see that it's like not going to kill, which it means it's not going to kill you or shorten your lifespan. Great, we all love that, right? But
Sure.
I
The
think
quality of life.
I think we would argue that it is not in fact harmful. It depends on which way you're looking at it, and I have seen a shift to aggressive and non-aggressive or I'm sorry, advanced and non-advanced. I misspoke.
Yeah.
Rather than indolent and aggressive, and I think that language makes more sense.
I agree.
But I think that it has not been officially renamed as far as I'm aware.
Mm-mm.
And that doctors that are not keeping up with every paper that's published or not on like a research team related to this stuff probably wouldn't have, that knowledge wouldn't have gotten passed down yet. That might be a more reasonable title to call it.
Well, hell, we're even dealing with like just what is tryptase? Why is it important? What number matters? How do you? They can't even get that disseminated effectively, and so to expect nuance in these terms and that sort of thing. Although I'm sure you remember this from our conversation with Dr. Abbas. His whole thing was he doesn't like aggressive. That's a crazy name. Like, don't call it aggressive, because that has it evokes something that advanced is still not great, but it's a little more descriptive, like accurately descriptive, and a little less fear-mongery.
I think advanced and non-advanced. I was thinking about it the other day because I was reading some website and it used those terms, and I was like, oh, I like seeing this a bit more because I think it talks about because that's kind of what it's literally happening. It's advancing to a point where it's taking up more space in your, the mast cells are taking up more space in your organs and your bone marrow. It's causing health issues, like more severe health issues because of that. And so it kind of, to me, it made sense.
It's a better
and I think
description.
it doesn't diminish the impactfulness of the non-advanced version.
Right.
So I think it's it describes it more accurately, for sure.
I think there's also something, now this may be way too much nuance, but there's something in that language that also really kind of makes me, anyway, reckon with this is a disease that can advance. And just because the vast majority of folks stay quote unquote indolent, which again, we are non-advanced, we're not talking symptoms here, we're just talking mast cell burden, right? It doesn't mean that you should be it doesn't mean that that shouldn't placate you. You shouldn't say, "Oh, well, then it's no big deal," because it's still something to manage. It's still new symptoms can happen anytime. New problems can crop up anytime.
It also makes
Yeah.
sense for the sake of people who, and I envy these unicorns a little bit, but people who happen to have mastocytosis who don't have symptoms.
Yeah, no
Uh,
symptoms.
I've seen people. Well, I've not met a person who has that experience personally. I have seen folks post on like social media groups. I sometimes scroll through and read things, and they were debating whether or not they should go on medication if they didn't have symptoms that they really felt like needed to be treated. And I think that it speaks to this. And I have heard more kind of through the grapevine stuff about this than I've read anything specific. So I want to like take it with a grain of salt, but that there could be some hope that the medications that are being developed now, and like the tyrosine kinase inhibitors that are on the market, and the ones that are potentially coming out, may inhibit it becoming advanced and affect that journey. And I think that
That was
using that
honestly why.
terminology different might speak to those people and be like, hey, this is a thing that can advance. I recognize you don't have any symptoms, but this is something you'd like to
Stay
you
on
would
top of
want to
it.
avoid. Right.
Yeah,
This is
yeah,
like,
yeah.
it's not something you need to brush off, like, and be like, well, it's not really affecting my life, so I
Yeah.
don't need to worry about it.
That was exactly what I was trying to say. Yes, that it staying on top of it is still important regardless of
Absolutely.
its stage. And so the non-advanced advanced, I think, it just is a more nuanced take. Yeah.
What of the barriers really spoke to you that we discussed?
I think that for me, I could talk about all of them pretty broadly. I still think there are other parts of the language conversation we could have, but we can come back to that. But
We can keep going with it.
for me, well, no, I think it's a fair question. I'll go ahead and answer it, and then we can figure it out. But patients' ability to navigate complicated systems. I have worked as a case manager for people who lived with HIV and AIDS many years ago, who were like who didn't have the means to access care, who had I mean, whatever the case may be, many of them had severe mental illness. Many of them had drug abuse habits. And many of them had problems that they were coming to us to help, just to keep roofs over their heads and to help them navigate a system which included like Medicare and Medicaid and Part D and this and that. And all that's changed now. I don't even understand it at all anymore. But it has only gotten more complicated. I am going through this right now, and I am an educated person. I keep up with as much as I can. I obviously have to navigate the system like all of us do. And I am finding myself in this place of I literally don't know what this one company who is somehow involved in whether or not I get my AVA kit, I don't know what they do. And no one's been able to give me a really good reason why they exist in this ecosystem or what they're doing that I can't do or that my insurance can't do between them and the pharmacy. No one can explain this to me. But what they can tell me is AvaKit's no longer on their formulary, so they won't be able to cover it anymore. Now, I don't know if that means AvaKit's no longer covered for me or if that means that now my expected copay is just the $12,000 a month that it was last year that I'll now be on the hook for, which of course is not an option. No one can tell me what any of that means. I call my insurance. They say, well, you're approved till the end of the year. Okay, well, this company is telling me they're not covering it anymore. Oh, well, we don't deal with them. What? Huh? Who deals with them then? And what are they doing? And why are they telling me this? Anyway, so that's a huge rant. That probably didn't make any sense to anyone. But it's just an example of
It's also the reality.
Complication, absolutely, of the overcomplication of our system, where you have too many other parties in your business and they make it complicated. And I don't even know it. I've called them all many times in the last couple of days, and I still don't have a sufficient answer as to what this one company did or why they were important. Still don't know. So I'll find out July 1st whether or not AvaKit's covered, I guess. I don't know.
And that it shouldn't be a thing we have to navigate, right? And like obviously we could talk about it till we're blue in the face, and it necessarily won't change these like overarching systemic, systems that exist that are just kind of designed to make our lives harder. But
yeah, they're designed to complicate, to make other people money, not to make the patient's experience easier or more streamlined or more direct.
Healthier.
Or healthier. Well, and I think about, so in all of that rant, I think about, even though my symptoms are not well managed at the moment, and that's a separate story, but like I can still muster up the energy and the attention to like go through the process, right?
Mm-hmm.
Even if I have to break it up over a couple of days or whatever. But if someone is desperately ill, then it's on their caregiver to do that. And you hope that they have the knowledge and ability and bandwidth to do it. And there is no one who you can go to say, this is the system. Here's what that company does. And here's why this is changing. Everyone can only say, I don't know. I don't know.
And I think, and one, I'm mad as that you're having that experience. Like you shouldn't have to go through that. There's been other points where I've been worried that or another medication wouldn't be covered, and figuring it out is a lot of phone calls and time that not everybody has an option to do, or the bandwidth, or
the knowledge,
energy, or the knowledge, or the. There's a lot of insurance literacy kind of things that you don't learn anywhere. There's not like somewhere, as far as I'm aware, other than going into like insurance as a career, which is not something I'm planning on doing.
No.
There is nowhere to learn a lot of this stuff. Things I have navigated in the time that I have been a chronically ill person have included being both a caregiver for loved ones who needed assistance, and myself. I have been moderately functional. I've been very non-functional at different points. I have been, I've tried everything. I've talked to advocacy services. None of these systems, I mean, they're meant to help, but there's like things like advocacy services, like trying to navigate. I've been on private health insurance. I've been on Medicare Advantage. And I've been on original Medicare in the last 10 years or so. And they're all so different. And I remember trying to figure out the Medicare system and being like, I'm extremely educated. I'm good at this stuff. I've been doing it for years. And I'm good at the internet. I'm good at research. I'm really good at calling people and finding information.
Yes.
And I had no idea what I was doing.
Yeah.
And I can't believe we expect people who are older, who might not be as experienced with computers or making those types of phone calls or questioning the systems that exist, because I think, like, depending on how you were brought up, that can be a little bit more challenging. Like, I don't know how any of those people are expected to navigate something. There was a phone number I could call for like your local area on aging type organization. I think the names might vary in different places, but and if you try to call during a certain time of the year when Medicare enrollment is, it's like a 3-month wait for a phone call, and I couldn't find anybody else to talk to. I've had insurance bills paid and then revoked. And then trying to figure out, like, between my doctor and I, why I suddenly owe them. This is currently happening with one of my providers. I got an $800 refund from them after fighting because they were misbilling as an out-of-practice or out-of-network doctor last year. I got a refund for $800. Now suddenly they've reevaluated these claims and I owe them $2,000.
No.
I'm like, I was like, my therapist told me that, and I was like, wait, no, I don't. I was like, hold on, I'm not paying you, but I am calling my insurance company. And then I had to flare up and didn't get around to it.
But see, that's the point. You had a flare up and you didn't get to it because you're sick, because you shouldn't have to, or you are sometimes too sick to do, you know what I mean? I mean, like, we have a cancer.
I also have a life. And so, like, when you get sick, then you're playing catch up on the existing responsibilities you have. And you don't really have, like, I don't really have space on my plate to add a lot more at the moment. So, like, there are a lot of these barriers. Man, we could do it. I feel like we could do an episode about each one of these barriers.
I know. I'm literally sitting here going, there's no way we're going to get through this whole thing as a mini-sode. I can't believe it.
I know. Okay. I'm like, we talk too much. So I was like, maybe we should be more of an overview and we can come back at another time and talk about these things more in depth.
I think that's fair.
Hopefully
I think
the listeners will agree with us.
Yeah, I think also we do have a Patreon. We're not asking for paid subscriptions to be a member on Patreon, but I do think, like, there are so many of these moments that we have where we have our own little side rants in production meetings, or we have our own conversations that I realize we've just shared some really relevant information with each other that I think other people would like to hear or relate to. And then things that aren't like full episodes. So anyway.
Yeah. No, so to follow up Candice's point, a lot of times we sit and chat for like a little while before we record these episodes because there's just something about having a person to talk to that kind of like gets where you're coming from and it gets this experience. I have, as long as I've been diagnosed, I think Candice is the first person within like 10 years of my age, because I got diagnosed really young, that I've ever met, actually, or spoken to. And it's just like, I don't know if I've ever told you that. I was so excited to meet you. I was like, oh my God, I think we're like almost the same age. Just because I'd never met anybody who was like...
Yeah, youngish.
You know, I was diagnosed at 21 and everyone I knew who had it was over 50. And there's just a very different place in your life. And so anyway, all that to say is like we end up chit-chatting about all this stuff. And a lot of times we talk about stuff that like we're like, man, we should have saved that for the podcast. So we want to really share those moments with folks.
Exactly.
Not because we're trying to like rake in the big bucks or anything, obviously, but we just think that these type of conversations kind of normalize a lot of the stuff we're all going through.
Yeah. Man, that was a really seamless Patreon plug. So kudos to both of us for that. Go join our Patreon, guys. Nothing is up there yet.
Unplanned.
Nothing is up there yet, but something will be eventually. Okay. So yes, I agree. I think that doing the overview is good so that we don't get too bogged down because all these are really important. I mean, I want to go. We've started, so now I just
maybe we pick a couple of things that we dig into, like maybe pick one or two more to dig into, and we kind of overview the whole thing and then go back and jump into one or two.
Yeah. I would like to talk about like, and I put this, okay, these are just my bullet points, guys, from the, I put it down as physicians' inability to guide patients. And that's like a little minimizing to the competency of physicians. And that wasn't the intention. But I think that's another important thing, not their inability, but maybe their lack of training on how to handle people with chronic lifelong diseases and how to guide them, especially in rare disease. And so I think like that was one of the barriers. And I think that's a really relevant barrier. How many of us, I got mine through my chart, guys. I was diagnosed through my chart by a nephrologist.
Wait, that's how you found out about it?
Yes.
That doesn't seem right.
So I'm just saying.
Surprise! You have cancer, but we're just going to like send you a text message about it.
Right? And, okay, so this goes back. This is the last thing I'm going to say about the barriers, then we'll move on. But the language barriers thing, like the shared language, just the word cancer is one of those very hard points for folks. And that's something that having the shared language does matter, though. And we can talk about all the ways it matters because it does. Like having a quote unquote cancer diagnosis, even if what you have is chronic and manageable, and there's lots of cancers like that. There's many cancers that are 100% curable, like for almost everybody anyway.
I have a friend who we bonded over the fact that we both have chronic cancers.
Yeah.
Like
my husband has one. So like it's a thing that exists. And I think that it's scary to hear the word. And I think doctors have kind of done patients a disservice by not wanting to call it that because they want to spare them the emotional pain, conflict, whatever that brings up for people, because cancer is a scary word. But calling it what it is accurate. And if you are trained well enough or you have a system in place to help your patients navigate that new diagnosis, help them understand what SM is, that it is not the big scary cancers that maybe you dealt with in your parents or family members.
Lowercase cancer.
Exactly. And so I think
such a thing exists.
Yeah. I mean, I think we can be accurate and we can trust people to have their feelings and then manage their feelings and then also have language that moves them forward. And it also opens up avenues for them that they wouldn't have had otherwise. You mentioned that actually in our last Heroes, because I've listened to it. I know you don't remember.
No, I vaguely remember it because I think it's so important. Like, I remember we talked about it at a previous Hero Summit about, I think someone had said something about being cancer. And I was like, oh my God, yes, I've been trying to get people to say this for years. And I have had barriers put up in place for trying to get workplace accommodations. Getting disability was like a multi-year struggle. The people making the determination about your disability are usually a judge with a minimal to, I don't know how much medical training they have, but it was clear that they weren't familiar with my disease.
Right.
at all. Like they tried
Of
to
course.
accuse
Yeah.
me of faking it because I had dogs. And I was like, but I don't have dog allergies or sensitivities. Like, because she was like, haha, you have dogs. And I was like, yes, then they're very cute. Why are we bringing this up? Like I wasn't sure
My
what
dogs had
and then it
nothing to
made
do
it
with this.
dawned on me that that was like an aha moment. I got you, but it's not relevant here. And so I think there's all these things that that calling it cancer opens up doors for. Better, easier workplace accommodations, because it's a word that tends to evoke empathy in people.
A greater willingness to understand, because people
right?
have experienced almost. Is there anyone you know who hasn't been touched by cancer in some way?
I don't know anybody. I imagine
Not
it's a
a single-
grandparent or a friend or a college roommate. I don't know, somebody in
Literally,
your life
someone
has
in your
probably
life.
had cancer, or somebody dealt with a loved one who had cancer. That it's kind of. It brings a sense of understanding. When you tell somebody of a rare disease that they've never heard of, that's really weird, that acts in all these ways that look really different between different people, that's a hard sell. But a word that makes sense to people makes it easier. So, you get more social, like the empathy you need to be accommodated more. You get better workplace accommodations, I think, or at least potentially. Perhaps long term, it makes it easier for folks to get on disability, which I think could be really useful for a lot of folks who are so limited or unable to work because of their disease. Funding for medications. There are so many cancer nonprofits. So anyway, all that to say, it's a really important thing. And when we talk about language, like these things have real impacts on the way we live our lives.
Yep. Absolutely.
The other thing I wanted to comment on real quick was when you mentioned the physician's inability to guide patients. I actually read that not as an inability for physicians to do their own job, although I think that there are limitations. I don't think doctors are learning a ton about mast cells in school, from what I've heard from physicians and friends and relatives that have gone to medical school.
At least not in the way that they contribute to disease states. Yeah.
At all. I think it's like this is a cell that exists in the body and they kind of move along, is my understanding. But again, I haven't been to medical school. But what I think what I took that as was these systems that exist don't allow doctors to guide patients, because insurance gives you approximately 15 minutes to see a patient. How can I cover? We can't even do a podcast in 15 minutes. Our before the podcast chat is more than 15 minutes. It takes more than 15 minutes to get ready in the morning. Like, not a lot can occur in 15 minutes.
Yeah.
And so I think that's an unrealistic expectation on doctors and patients that really harms both parties.
Totally.
And the ability to really for doctors to show up with the amount of care and compassion and ability to listen and support and be a teammate to you as a patient. But also patients aren't getting the care they need. They are not getting the information they need. They're not getting the doctors don't have the time to do the research they might need. I mean, if you have a rare disease, you need someone who's going to be willing to do some homework.
Yeah.
So all those to say,
who understands the implications of rare disease, which is beyond just symptom management. It's like, there's psychosocial issues. There's so many things. Yeah, no, totally. There are all of those barriers they still exist. Certainly. I do think we're making great progress. And so that's what I'll turn to now from those. And I do think we can have deeper conversations about in more depth about those in shorter bursts that we'll share elsewhere.
But maybe it would be great if patients wanted to comment on this and tell us which ones they'd love to hear more about.
I mean,
that would help guide us where we're going.
I'll say it again and again, always. Any information, an email, a voice note, I don't care. Find me somewhere. You can find us on Instagram and Facebook. You can find me in support groups. You can email us at podhost@mastcastpod.com. Please, I want to hear from you guys. I love that. So pivoting back to the progress we've made, and then some areas where there is progress to be made, but there are ideas. So as far as barriers, I mentioned things for doctors, that not barriers for doctors, sorry, but things for doctors to keep in mind when it comes to helping a patient be that empowered person who can go about managing their lives with SM.
Yeah.
Some hand-holding is necessary, and that's going to go back to our previous conversation, what we were just talking about helping your patient understand their disease, really understand it, not just helping them understand what kind of tests are going to be run and why those tests should be run and what those might say, what things they should be looking out for, how they should literally education on how to use an EpiPen. Guys, can we please teach people how to effectively use and when to use an EpiPen, please? Instead of just giving them to somebody and sending them on their way. It's wild out.
Also, there should be general training about this because do you know how many people in my life have thought that what was injected into, I don't know, was it Uma Thurman's heart during Pulp Fiction was epinephrine?
Epinephrine instead of adrenaline.
It's not. That's not how you give epinephrine.
Right.
No, completely inaccurate. But like as a whole, we would all be safer if both we were trained and then we could train the other people in our lives who might be around us.
Yes, absolutely. Absolutely. So yeah, really just the need to be, especially when it comes to a rare disease that is hard to find information about, really having a plan for when patients are diagnosed to help them understand their diagnosis. And then helping them understand the language, the jargon, that wraps into everything we were just talking about, but and where to point them to for factual information. So other than for doctors, like things that we discussed that they can do to help patients, just in the exam room, like in my chart messages, in whatever they have access to help patients access resources and information. There was sort of a portion of the conversation that I feel like was really for the community. And by the community, I mean all of the folks who have the resources and the charge to work for and with people living with SM, if that makes sense. So nonprofits, pharmaceutical companies, specialists, research hospitals, whatever, that kind of thing. One of the big ones that came out was really building an evidence-based, solutions-based library for patients that is validated, curated, and kind of universally agreed upon amongst experts. And this would be a database. Look, there are many resources, not many, but there are quite a few, honestly, considering how rare the disease is. There are resources for people with SM. And TMS is an amazing resource for their webinars and you can research papers, all that good stuff. It's great. But using some of that plus other research information, just collating information and putting it into a database that will give patients factual resources to draw from. And also, that will give them resources that sort of bullet point and outline some of the major things. They're not having to read a research paper. They're not having to try to understand basic science. One of the things that was suggested, and I don't want to not acknowledge the complications around AI, but one of the things that was suggested was a large language model that is fed and vetted by physicians who study SM with the relevant data. And rather than patients who will absolutely turn to Gemini or ChatGPT or something else to find information, giving them a conversational chatbot, which chatbots galore, and they can be very useless most of the time, but that's specifically fed to have a conversation with a patient and understand their questions and their needs and provide them with factual information with resources attached to it that they can explore. And I thought that was an interesting piece of technology that could come from it. Other suggestions were, well, it kind of gets into the tools to overcome barriers. There were these areas kind of commingled. But what was interesting is differentiating between, so having kind of two tracks around what the resources are for, whether it's for people who are diagnosed or people who are undiagnosed and seeking diagnosis. Because I do think those are two kind of separate areas of needed information. Seeking diagnosis is complicated. Knowing what tests to ask for, knowing what to advocate for, knowing what signs to look for, all that kind of stuff is really helpful and relevant. And I thought that was a really interesting takeaway from the conversation.
I think it makes sense to have kind of support at the different stages of figuring out what's going on, right? So you have support in figuring out what's going on with your body. And then also once you do have an answer, more support that tells you cool, here's how you navigate your life now.
Yeah.
Here's what you should be asking your doctor, making sure, I think the guidance has shifted about what things should be tested to some degree. I've heard various things in different webinars and I'm is my doctor doing that? Like it was like a new, every once in a while I hear a new term I don't know the definition of. And I'm like, where do I find more information about this? Like I would love more resources for that kind of thing, like long-term living well with this disease.
Yeah. And this is the kind of thing that can be, I mean, usually these kind of things, if it's done right, are captained in a way by a committee of folks that include patient voices, that include advocates, that include doctors. And that's really important because it brings, again, if we're talking about empowering patients, we need to understand what questions do patients have? What are the things that are most pressing? What are the things you're not thinking about that are really important to them and that we need to have resources for? So a lot of it came down to like sort of just brainstorming around technologies that can help us out, even as simple as having a QR code in your doctor's office that leads you to the TMS website with other patient resources, or that leads you to a website that specifically has a list of patient resources, or something like that. Even something that simple, that's vetted, that's for sure those resources are going to be accurate, could be immensely helpful.
And I'll be honest, I have some concerns about the AI side of it, about, the impact on the environment. I mean, there's like 1,000 different things, right? But
of course, yeah.
Realistically, in the systems that we live in, it is unlikely that doctors are going to have the bandwidth, time, energy. I mean, there are people who also have their own lives where they can, from scratch, build a whole network like this, especially if there are technological ways of making that more efficient and not taking up, like that in itself could be 2 people or 3 people's full-time job for a while.
Absolutely.
And so I think that while AI is not personally my favorite thing, that there might be applications here that are
so we're also,
as opposed to not having that resource at all.
We're also talking about different levels of AI. I think that's worth
Correct.
understanding. Like, we're not talking about like generative AI where we're generating videos and images. We're talking about large language models that have been fed with data. I'm not saying it's not. I'm not going to argue because I don't know
And I'm not
enough,
trying to get into like the weeds with this, obviously. But like, what I'm saying is like, at the end of the day, I would rather have a resource that helps people, regardless of which avenue gets us there to a degree.
Yeah, yeah. And I think chatbots are pretty direct and kind of a small scale solution. They're not solution, but tool to use these things and to help navigate systems like that. So I thought it was an interesting idea. And to your point, it would be someone's full-time job. That's not a small. It sounds like, oh yeah, we'll just
a big
do this thing.
Regardless.
It's a very big undertaking. Yeah. But yeah, so technology aids were some of the things that came out of it. Is really, and I feel like technology aids can be kind of, we don't have to get really complicated with it. So I think even for some folks, a QR code would be very confusing. And if they've never used one or they've not been around them much, or that can be hard to navigate. So I'm talking about a link that will sign you up for an auto-generated newsletter from a resource that has been vetted so that you get in your email once a week or once a month or whenever, real resources, new information, reminders of where you can go and what you should do, that sort of thing would be immensely helpful. I think apps were a big, applications, phone applications were a big part of it, whether it was for tracking, which I know I feel like that's a whole episode, tracking symptoms and all that stuff. But so having those kind of resources available for tracking your symptoms, but also to go to as a resource. So an app can be a resource as well. It can be also loaded with I feel like all of these things can come from the same sort of central database or like central information hub, and can feed all these different ways to communicate. And that kind of goes back to that barrier of communication styles and preferences. Like everybody's going to have a different desired way to learn.
I think those resources could really benefit patients. Even if even if we're doing real simple, right? A handout could have QR codes, it could have a URL, it could have both. That your doctor gives you, that gives you 5 new places to go look for information when you leave your office.
I was really thinking if the doctor's office utilizes something like MyChart, if they have an online resource that for newly diagnosed patients, especially an auto-generated email that goes out to newly diagnosed patients with all the resources that they need to start understanding their disease, with support groups, with resources that doctor can provide, what their care team should look like. I mean, all the things that you can think of when it's like when you're a newly diagnosed patient.
There's a lot there too. Like it's
So
so much you need
much.
to know.
And that can be an email that's just, okay, this diagnosis code gets this email like upon first diagnosis, or this message in their My Chart. I don't know. It's just like we have so many systems in place already. We can definitely utilize them better for better patient outcomes, because right now in the system we're in, we're not going to get more time in the room with our doctors, more than likely. I am very fortunate. I get a lot of time with my doctor, but he only sees SM patients, and I think he sees 9 of us or something. I don't know.
That's wild.
So I
No
have a
wonder he
lot
was
more.
he was so awesome. He could really spend the time with you that you deserve.
Yeah, I mean, it's funny. I still go into a. Sorry, I keep moving my head around away from my mic. I still go into those feeling rushed, but I think it's almost like I mean, it's me. I'm feeling rushed about it, because I'm like, okay, I got to get in and out. And he doesn't want to hear all these 30 different complaints. But no, he actually does, because it's relevant to my disease and my quality of life and all that.
And I think that in lieu of so obviously there are barriers here that are so big that we can't solve them. The blueprint pharma companies in general, the changes that would need to take place for these barriers to be lessened or changed or shifted or something like that would be massive and not structurally
Right.
plausible.
We're not
right
going to
now.
have more time with our doctors in general. So how do we
I mean,
develop
I do think there's
systems?
ways that you can go in and be like, hey, I know that I have had doctors that tell you if you think you're gonna need more time to let the scheduler know, and sometimes they can squeeze in a little bit more time. Certain doctors are willing to do that, some are not. Depends on the practice and what they're doing, and the doctors themselves. And generally, it's not an option. So, we were trying to all focus on things that would be within our control to shift, things that
Yes.
Blueprint could have a hand in and help improve, or that other pharma companies, or that the doctors who were
Or
part of this
TMS,
conversation, or patients.
Yep.
So I think that while these ideas are not going to solve all of our problems, we're trying to look at it as given the systems we exist within, how can we improve things?
Yeah. And some of the other, I wish I could remember specifics around resources for physicians, staff, to help them understand the patient experience and needs. So really just educating the whole office so that they kind of know. And I think some of that is, don't wear fragrances to work. Don't light a candle at your desk. Don't things like making it a more hospitable environment for folks like us. But also just to help them understand the state patients might be in when they're coming into the office, or the brain fog issues where they might need extra help navigating a step or two because it's just not computing in their head. I thought that was an interesting one. And then I think the one I liked most as far as tools to overcome barriers, and this is just purely selfish at this point, but it was highlighting patient stories. I thought that was a really unique take, and I thought that was it was also really accurate. It's one thing for doctors to tell patients things, and hopefully they understand what the patient is going through, but by highlighting patient stories, you're making it real for everyone, not just the patient who gets to be validated and hear that they're not crazy and they're not alone and they're not whatever thing that they feel around it. But it humanizes patients to doctors as well. It makes them a whole person, and the disease more real, I think.
Yeah, I agree. I also, and this one is not on our current list, and I don't see it on we're working off of, obviously, we went to this conference a little while ago, and I don't know about y'all listening, but my
Oh, I
memory
don't.
is not that great. And I think that has something to do with my mast cell disease and maybe my ADHD, and maybe, I don't know what else is wrong with me. Who knows? But so we're working off this really wonderful blueprint at the Hero Summit. Had these really incredible artists doing live infographics on these huge poster boards that we have photos of. So not only are they visually really fantastic and stimulating, but they're also really informative and help we're pulling from here. So what I was going to say is not, as far as I can see, and there's a lot on here, I don't think it was talking about it, but I do think it came up in the meeting, and I might be misremembering. But I also think that there's something that could be said for patient, like peer support, that could be really
Certainly.
beneficial.
Yeah.
And I do think we talked about that, at least in the group that I was in. I don't know if it was reflected on this, but I had talked about it in other meetings as well. I
think that could be part of that whole highlighting patient stories.
Mhm.
Just like the patient voice, but yeah, I think that's, MD Anderson does something like that. They have you can sign up and do a training as a volunteer who is like, they will connect if a patient comes in and is diagnosed and needs some support or would like to ask questions of someone who knows the disease and has lived with it, then they can ask to be connected to someone, and the volunteer organization will connect them with another patient who is going through the same thing. I think that's huge. I think I've said it before, I'll say it a million times, the Zoom support group was crucial to me to
Yeah.
getting through the first year or so of diagnosis.
And I love that stuff exists, that stuff exists. I think I was diagnosed for 2 years before I even talked or met another person who had this disease, because they're just outside of, like, a single Facebook group that was far smaller at the time, I don't think that there was a lot of ways to meet anybody, who had this disease. And I just think there's so much there that could benefit patients on both sides of that equation. I was talking to a friend recently about how, they said something to me about how, like, me talking about my experience or, like, telling them things that I had done to make things more accessible when I was trying to, like, navigate. We have different disabilities, but, like, advocating for yourself, different things that, like, you have to kind of learn to do in those situations, really made their life easier. Like, that they thought it would take longer for them to figure out how to navigate those things if I hadn't shared that stuff and if I hadn't been, like, a big person in their life. And they were just kind of like, it just really kind of cemented how impactful I think those types of relationships can be. And it also felt really great for me as somebody who's, like, been through stuff that at different points felt really challenging, to be able to take that and help somebody and make their life
Yeah.
easier based on those experiences. And so I
Absolutely.
think that, like, there's a lot there, and I think maybe some combination of things or multiple facets could really give patients the power and knowledge, and the empowerment and the knowledge and skills to confidently live with this disease. Like, that would really help accomplish the goals that we set forth to discuss in this meeting.
Well, I think even more so, I like that we're ending on that specifically. I think even more so because I don't feel particularly empowered when I leave a doctor's office. I don't feel particularly equipped to manage my disease when I leave a doctor's office. I have a new drug maybe, or I have some insight into where something might have gone wrong or what might be causing this type of reaction or whatever, but it doesn't empower me to then take control of that thing. There aren't answers or solutions or suggestions beyond take this pill, don't go outside in the heat, or whatever the thing is. But going and talking to people who've been living with the disease for years and who've been navigating it at different levels, seeing what they accomplish and seeing the solutions they find for themselves. And I know we've mentioned it before, but I really want to have someone come on who lives alone, who doesn't have a caregiver there every day, because they're ingenious the way they come up with solutions to the issues they might face. And that to me is real empowerment. It's like really showing, here are, like, we can accomplish living a life. Like, we can do that. We just have to make some accommodations. We have to make some changes here and there. And there are some really just simple and smart ways that people do that. So I think that's a really good one, I think, to end on. I
Yeah.
agree.
I just think it can be so impactful, like, not having to reinvent the wheel to figure out how to make your life a little more accessible. Like, if somebody else, even if it's not a tip that specifically works for it, because, like, the way these diseases present are so varied that,
Of course, yeah.
but someone's solution for navigating a severe food sensitivity is going to be very different than what it looks like for me navigating a really severe fragrance sensitivity. But something they say might like make a light bulb go off in my head, and I'm like, oh my God, I can do this. Or if nothing else, it normalizes it. Like, that same friend told me that me wearing my hat, like when I go into stores, because my hair picks up so much fragrance, or like in public bathrooms or like that, like me normalizing it by just doing that and having it like rather than not going out at all, just doing all these objectively maybe a little weird looking things. Not that hats are weird, but like
yeah, I get it.
Anyway, you get what I mean.
It's the middle of summer. You're wearing a beanie, Rachel. What's wrong with you?
My God, I'm like sweating to death. It's awful, but it helps. But long term, like it makes my life more accessible. And they told me that like they needed a mobility device, and like that they probably would have waited a lot longer and pushed themselves a lot harder than they needed to before getting it if they hadn't seen it normalized for them. That somebody else, like instead of making their life smaller, I just like I tried to find ways to make my life more accessible without making it significantly smaller in ways that don't work for me. So like those are things I think patients can teach each other that you really can't learn anywhere else.
Absolutely. I mean, I certainly learned what types of doctors I should prioritize seeing at first before I had a specialist. I learned ways to make my home safer if I were ever to go into anaphylaxis and was alone. Like, how would I communicate that to a professional if assuming I was able to get a 911 call off before I passed out or something? Like, there are so many different things that we can do. I think also there was a fair amount of that peer support helped me really reckon with and understand that this is serious. This is something that I'm living with. I am actually experiencing it. And I have the right to take up a little bit of space about it. Like I can accept that this is something I'm living with, and I can also request from other people what I need and take the rest that I need when I need it. So like there are so many ways that we can help each other.
It's endless.
But
we
I
had
think
to talk about this forever.
I know. But I think with that said, that covers that first aspiration. And I think we came up with some good ideas for things to talk about, maybe on Patreon and smaller bursts around these different barriers. Again, we would love to hear from you guys. In the outro, we give all the ways to connect with us, but I'm in the support groups on Facebook. I'm on Threads. I'm on Instagram. The podcast is as well. So feel free to message and share your experiences and thoughts. And we'll keep doing this.
We'd love to hear from you, and thank you so much for listening.
Thanks, y'all. Bye-bye.
Have a good one.
Thanks for listening to Mastcast. Your hosts are not medical professionals, and nothing discussed here should be taken as medical advice. Please speak to your medical provider about any issues you're experiencing or therapies you're interested in. If you have any questions or comments, please email us at podhost@mastcastpod.com.